Hello and welcome to our very first Wicked Problem Impact Project Showcase, where we will be hearing from Team Pinwheel Project with Laura, Matt, and Maya. Today is Thursday, October 3rd, 2019, and we will be hearing more from the team and their work on the long-term societal and personal impact of unaddressed neurobiological health concerns in early childhood related to lack of awareness, public funding, and political support, and is further compounded by siloed approaches and fragmented programming. So that was a macro vision, as described in their latest abstract, but they're going to be breaking that down for us today in this presentation. Yeah. So before we begin, I'd like to share a bit more about the intention of these showcases. So they've been designed to offer the chance for the teams to practice communicating about their project work over the past 2 years to external audiences. Each team will talk about the inspiration for its project, the project's design, the implementation process, and some of its successes and lessons learned in the process so far. So these showcases also provide the chance for the team to hear feedback from their peers about the effectiveness of the presentation and considerations around how it can be improved. So we encourage all of you in the audience to make notes about the information, about how the information is communicated in this presentation and what the team shares about their work and learning. You can chat them into the chat box when you think of them, or you can save them for afterwards. So this feedback will be very valuable as the teams hone their messaging throughout this final year. So now I'm going to turn things over to the team to begin their presentation.
Hi, everybody. I was going to say good morning, but good afternoon. This is Laura, Maya,
and Matt.
And we're really excited to share with you our project today. So I guess we'll just get started. So we'll be taking you all through our project planning, the design of our project, the work we've been doing for the past 2 years, how we're evaluating the project, and then the next steps that we're working on currently.
All right, how it all began. So I'd like to start, I'm going to figure out how to use these slides. Give me a second. So I wanted to start by giving some background information on our community. According to the Santa Monica Youth Wellness Report Card, 1 in 5 children entering kindergarten is vulnerable or at risk in social and emotional development, which means in preschool, there are about 4 to 5 kids in each class that have significant social emotional needs. That also doesn't take into account the children that don't live in Santa Monica but attend our preschool programs. So that's only the Santa Monica data. As you might expect, there are also some noted discrepancies among low-income and racial ethnic minorities. And there are also some other significant challenges to access, including which programs they belong to and what insurance they had. Before we started the Pinwheel project, our preschool department had 5 different programs, and only one of them, Head Start, required and importantly funded a mental health component, which consisted largely of screening and referring to outside mental health agencies. Other than program challenges in providing mental health support, there were other barriers I faced as a school nurse in coordinating mental health services for preschools. Frequently, the children didn't have the right insurance to see highly trained early childhood specialists, or they did not live in the right service area boundaries for services, so those not living in Santa Monica, or were stuck on long wait lists for care. So I had a lot of children with high levels of social emotional needs that could not get access to needed services, even if we got parents to agree, which is also another challenge, as you all have experienced. So why is this important? I won't get into it too much. We kind of all know about ACEs in our Clinical Scholars Program. Essentially, they have childhood trauma. You might see in classrooms they're inattentive, maybe challenging or defiant behaviors, withdrawn and unengaged. So that makes it difficult to master the skills to be successful in school, such as participating in group and individual activities. And without this social emotional foundation, they can't attend to the higher levels of school functioning. And then they start to fall progressively behind each year, leading to poor academics, expulsions, suspensions, truancy, dropout, delinquency, substance abuse, mental health, and then later on in life, negative employment, legal, and health outcomes. This we're all, I think, pretty familiar with our with our ACEs work we've done in Clinical Scholars. So with that in mind, at one of our community meetings, well, let me back up. Laura and I had partnered before to provide a social skills group to our preschoolers. So at one of our other communities, we were talking about, I was discussing the challenges with getting children access to mental health care. And after the meeting, she approached me with an idea that started our Pinwheel project. So entering kindergarten with a strong foundation of physical and social emotional health is one of the best predictors of a prosperous and healthy future. Like my little picture of the guy, he's got a happy, healthy future. So our shared vision was a systems level change in early childhood education with a transdisciplinary whole child approach as standard practice, and to build momentum for children for lifelong success.
So the design of our project, we wanted to run you through our timeline of the 3 years, and we wanted to use this model here that we've been using in our training. This little image that you see in front of you with initiate, cultivate, and sustain is centered within that circle of the relationship. And so for us, that really shows how crucial the relationships are in our project. And this initiate, cultivate, and sustain is something we'll be talking about later in the presentation for how we've developed our training curriculum on our project. So I will let Maya start with initiate.
All right, so we initiated, like I talked at our community meetings, we gathered community partners and got some assessment data of kind of needs. So the transdisciplinary piece, what healthcare, what physical health we could provide, the nutrition people, what agencies we'd worked with that could provide support, and building the links between community partners to really provide that interdisciplinary and interagency collaboration. We started also initiating the mental health consultation program in each classroom in our Santa Monica preschools.
And then in year 2, we went from initiate to cultivate. And the idea of cultivate is after this, like either relationship or collaboration has been initiated, you're taking that foundation and then building upon it. So we continued our consultation work in year 2, and we further refined our approach. And we built off of just the mental health consultation to really begin our interdisciplinary work. So this was the inclusion of nutrition and the inclusion of occupational therapy in addition to our mental health consultation. We continue to strengthen our collaborative approach, and we actually developed and started our research program as well.
And then in year 3, we're moving into our sustain phase of our project. And in this phase, we're really hoping to begin drawing conclusions on that research, working hard on our sustainability plan, and then even further strengthening our collaboration and consultation, and then actually beginning to disseminate this out into other areas. And then in terms of additional resources, we did want to give acknowledgement to additional funding that's coming from Matt and my agency, Providence St. John's Child and Family Development Center, as well as Maya's organization, the Santa Monica Malibu Unified School District. And then we are able to bill some of our services to the LA County Department of Mental Health. And then our additional resources are coming from
so we have a really resource-rich community, which we're so grateful for. So we have UCLA virtual dental home program that provides dental exams and small treatments actually inside the classroom. UCLA also, their Jewel Stein program does vision screenings, and we have the mobile eye clinic that provides free eye exams and free glasses to students. And then we've also partnered with different community agencies and partners to provide nutrition education workshops and different nutrition activities as well in the classroom.
And then in terms of other partnerships, we've gotten really involved with groups that are working towards advocacy and promoting similar goals that we're trying to promote of kindergarten readiness, equity in access to services and care in preschoolers. So we're a part of the Early Childhood Task Force, the Building Blocks for Kindergarten, and the Arts and Literacy Festival in Santa Monica. And so then getting into the actual work of our project, we wanted to take you through a little timeline of, let's see, there we go. There's my little clicker. Can you see that, that clicker?
The arrow?
The arrow? Okay. So we started out our project with a needs assessment and asset inventory, and that was in partnership between the Child and Family Development Center and Santa Monica Unified School District. And then we began our mental health consultation, and that was actually several years ago before we started Clinical Scholars. And we were doing mental health consultation just in a couple of the classrooms. And then we got our RWJF Clinical Scholars funding, which allowed us to really begin thinking about how we might do this in an interdisciplinary way and expand into all of the classrooms in Santa Monica, as well as development of our ideal vision of what this might look like. If we could really do this the way we felt like it should be done, by coming around to the child in the classroom in a holistic manner, what would that look like? And that importantly involved community involvement, that it wasn't just us, it was that we really needed to help create a strong network around the school and around the child. And then as we began to implement these different components, we got to a point where we started to think about, well, it looks, sometimes people get us confused with other programs, like Head Start, for instance. So we began this process of differentiating ourselves. How are we different from Head Start? How are we different from other mental health consultation models? What makes our program unique, and what's really core and crucial to what we're doing? And from that, we were then able to develop a curriculum that would allow us to disseminate our model out to other regions and agencies through training. And that leads us to our dissemination efforts. And after dissemination, we're hoping to be doing ongoing evaluation and constant feedback and refining of our process. Okay. So to let you in on some of the other people involved in this work, we've got here our larger team of mental health consultants. And so this is the current team of consultants. We went to a conference, and that was where we took this photo. But it consists of 6 LCSWs, which is licensed clinical social workers, licensed marriage and family therapists, and licensed psychologists, who are going out into each of our classrooms for an hour each week in each classroom. And then on the school side, we have our school admin that are a part of our team. And we wanted to provide a clip from our partner here, Susan Samarge Powell. She is the Director of Child Development Services. She oversees all the preschools in Santa Monica that are part of the public preschools.
And so in particular, at one of our sites, we had a little girl who was fairly non-communicative. She didn't speak as much, she didn't participate with the children as much, she wasn't as engaged as the other children, in addition to which her family wasn't either. The parent who kept bringing her in was very quick to sign in and out, but didn't really participate or speak with the teachers in any manner that gave any information to kind of help them help her. The teacher, seeing this, felt very fortunate that she had someone in her classroom from the preschool wellness consultation with whom she could talk. And then that person kind of assisted her in providing opportunities for the child to engage in different manners in the classroom. And then the consultant was also able to work with the child and then ultimately the family. And I have to...
Okay, so I got some feedback that you're not hearing the video. Let's try that again. Oh, everyone's hearing it. Sorry, we're gonna play the video again. Mixed feedback. Sorry, we're playing the video again.
And so in particular, at one of our sites, we had a little girl who was fairly non-communicative. She didn't speak as much, she didn't participate with the children as much, she wasn't as engaged as the other children, in addition to which her family wasn't either. The parent who kept bringing her in was very quick to sign in and out, but didn't really participate or speak with the teachers in any manner that gave any information to kind of help them help her. The teacher seeing this felt very fortunate that she had someone in her classroom from the preschool wellness consultation with whom she could talk. And then that person kind of assisted her in providing opportunities for the child to engage in different manners in the classroom. And then the consultant was also able to work with the child and then ultimately the family. And I have to say that the teacher, who has been doing this for quite some time, was so excited to see that this child started to engage more and started to have more friendships in the classroom. And the parent, although she didn't necessarily participate in more group activities, the parent stayed longer and gave more information so that the classroom teacher could help the child make some changes for herself. So there was an immediate opportunity that was taken that we ended up seeing a really positive change for that little girl.
Okay, so hopefully everyone was able to hear that, and that really gives an example of one case study of one child and how our mental health consultants were able to work in partnership with the classroom to create change for not only that child, but the teacher and the family. And then we also have our larger team of interdisciplinary partners. So we subcontract with some interdisciplinary providers. We have an occupational therapist, Karen Carey, who comes in. We have an educator, a nutrition educator, Laura Kainsinger, who provides a nutrition and parenting group. We've got a registered dietitian who works with children and families, Brooke Dukovsky. And then, as Maya mentioned earlier, we provide dental exams for every child in the classroom through UCLA Venice Family Clinic Virtual Dental Home, and then vision screenings and exams for children who need them, screenings for everyone and exams for those who need them through UCLA Jewel Stein Associates and Mobile Eye Clinic.
We also provide hearing screenings for everybody, but I do them. We don't have a community partner.
So that's Maya. And then even further out, we have our community partners in the community, which I've already kind of mentioned. The Building Blocks for Kindergarten group, our work group, the Early Childhood Task Force, and the City of Santa Monica. And the city has been really instrumental and enthusiastic about our work and promoting our project. So thinking about who is impacted, in the district, we're impacting 350 preschoolers and their parents and families across 18 classrooms. And that includes 20 teachers, the school administration, the larger community of Santa Monica as a whole, and now Los Angeles County as we've expanded out in our dissemination efforts. And we wanted to walk you through this new diagram that we've been using to talk about the how and the what of what we're doing. So you can see our 4 components here: mental health, physical health, occupational therapy, and nutrition. And I'll walk through each one to describe how each of those are interacting in the classroom. So in the mental health domain, we've got classroom-wide interventions, targeted or focused group interventions, and individual child interventions. And an example of the classroom-wide interventions is helping the teachers to administer a social-emotional curriculum or to adjust their teaching strategies to support the social emotional needs of every child in the classroom. An example of focus groups might be pulling aside a small group of children who are having externalizing behaviors to work on a specific coping strategy. And then at the individual child level, it might be working with a family and a child to connect them to mental health services like therapy. In the physical health domain, I'm going to let Maya talk about that.
Yeah, so as I mentioned before, so we do vision and hearing screenings for everybody. All our 300 plus kids have a vision and hearing screening, and then those are referred. We do full eye exams and provide free glasses for those that need them. All children are required to have a physical, and we also kind of built upon that, and so now they have to have a physical every year. And as well as anemia and lead screenings, because that's important for this age group. Dental exams, we also have expanded that as a requirement of all of the children. So they all have dental exams, and then we partner with the UCLA Virtual Dental Home Program and provide dental exams for those that don't have a connection. Also, just in general, so we have, so for all children, they have, I do a physical health assessment on all the kids, and they all get referral and follow-up as needed, and we provide a lot of parent and teacher trainings. The targeted group, so this is everybody, and then also we do more targeted groups for, say, children who, so families of children who have anemia, for example, we'll do a targeted workshop with those parents. Individual child, we have health care plans and referrals for physical health.
And then for occupational therapy, again, we have the classroom-wide, the focused or targeted groups, and then individual child interventions. And at the classroom-wide level, we're working with teachers to think about how their way of managing the classroom might impact children with different sensory needs, and also adjusting the classroom environment as a whole to be sensory friendly for multiple children. Then in the targeted group level, we're pulling aside small groups of children with similar sensory profiles to work with them on getting their sensory needs met. And then also working to provide parent and teacher trainings at the individual child level. And for nutrition, again, we've got classroom-wide, targeted, and individual interventions.
And I'll kind of go in the classroom-wide, we have parent and teacher training. So our RD also works with the teachers to provide nutrition education into the curriculum, and then we provide like parent workshops. We also have, each child has a nutrition screening when they enter, and each year. And we go through, again, we have the consultations for targeted groups, like I mentioned. So anemia would be a crossover with health and nutrition as an example of parent groups. And nutritional assessments and care plans for kids who have things like special diets or diabetes or other nutrition-based healthcare. Oh, and I forgot to add, on classroom-wide, we also are doing height and weights on everybody and using that as the over and under weights as targeted groups as well.
So then as you see them all come together, we've got this pinwheel of interventions and services at the classroom-wide, targeted, and individual child levels. And when that pinwheel starts to spin, they all become integrated. So we're not just doing siloed multidisciplinary work, but we're actually doing transdisciplinary work. So the mental health consultant is working with the occupational therapy consultant to think about how a sensory profile might be contributing to a behavioral profile of a certain child, and how bringing both sensory and behavioral strategies together might be what's needed in the classroom or for a specific child. Okay, and then just to share with you some of the materials we've been able to create this year. We've got our newsletter out and going, and mostly thanks to Maya, and that goes out on a monthly basis. We've got, down in the left-hand corner, you can see one of our new logos. So we did a branding. Sorry, there's some motorcycles going by outside. So we did a branding, some branding work this year, and we've got our whole brand DNA and brand brief that we're working with now, and our logos that we have. We created our curriculum and training binder. And you can see down in the lower right-hand corner, Matt is delivering one of the modules of our training to the LAUSD school-based social workers. And then up in the right-hand corner, we have a lot of different forms and resources that we've developed for our consultants to use in the field. And so now I'll send it over to Matt.
So now I'll move into the project evaluation and achievement outcomes so far. And I'm noticing the time, so I'm going to go through these a little bit quickly, but not to downplay the work that we've done so far. So we've been doing mental health consultation in local schools for, Laura and I were discussing this earlier, for 10 or more years at this point. And with the support of clinical scholars, we're now going into our third year of this more transdisciplinary model of the true preschool wellness consultation approach. So doing the work in and of itself is a huge achievement, just because of the amount of coordination and efforts from a lot of different people to make this happen. So that's an achievement in and of itself. In addition to the mental health consultation piece we've been doing, we officially have the occupational therapist consultation in every classroom. And on the left side of the screen there, you can actually see occupational therapy kits that we were able to put together for sensory integration regulation strategies in the classroom. And each classroom in Santa Monica has their own occupational therapy kit that we work with them on using for the students. We've done 2 different series of the nutrition and parenting group, which helps with healthy foods, healthy behaviors, and they received high evaluation. And part of those nutrition groups, we also provided food to the families and got feedback on the sense of community that it created amongst the participants. So I actually had a family that I worked with in the schools. It was a very isolated mother. The child was having a lot of challenges. She was very hesitant to attend this group, and she started attending on a regular basis. And she came back to me one day and said, Dr. Matt, I just have to say, there are other people who are going through the same thing that I'm going through. And it was a very validating experience for her. And she exchanged phone numbers with other families. So not only is it nutrition, but it also really helped build community amongst our families. And we've also gotten initial feedback from the district's qualitative feedback about the positive impact at the teacher and classroom level, much like the story that Dr. Samarj Powell was sharing earlier. Continuing, so Laura mentioned it earlier, and we're continuing to get guidance and feedback from Building Blocks for Kindergarten, our advisory committee. And on top of that, because of the work we've been doing in the community, we've gotten a bit of media attention as well. So I was actually shadowed, and our consultants were shadowed doing the work in the classrooms. And our local NPR, so KPCC, we had Priska Neely, who was the early childhood, like 0 to 5 reporter, and she really focuses on things like health equity in the community, particularly preschool expulsion and disproportionate rates like we were talking about, primarily for young African-American children. And she was really interested in our project and how our project addresses not only the discrepancy there, but also preschool expulsion. Unfortunately, she transitioned to another agency, so we're going to be following up with NPR to see if we can continue to get that story out there. We also got similar publicity in Catholic Health World, which is for all the Catholic hospitals nationwide, and we got an article published about the work. We had a whole issue about the work that's happening at our agency with a specific focus as well on our project. In addition, we got IRB approval to start our research program, and we have started data collection last year and just got IRB approval to renew it for a second year. So we're continuing to collect data to see how our program is doing. I'll talk a little bit more about that as we go further along. One of the bigger achievements so far of our program in terms of doing the work and getting it out there, we got approached by the Department of Mental Health, which I believe we have spoken about before, who requested that the Pinwheel project train a pilot site to implement our model. So not only were we doing it in Santa Monica, but this would have allowed us to disseminate into Los Angeles County. The Department of Mental Health request for various logistical reasons fell through, but from that came this LAUSD training where we were asked to train their district in the mental health component of our program. So we were able to, with all of our minds combined and resources put together, develop our curriculum. So you can see it on the left there. We had a full binder that we presented to all the LAUSD people that walked them through not only our mental health consultation program, but oriented them to early childhood mental health and early childhood development in general. And it was a really neat experience because everyone came together, including our mental health consultants, to participate in the training of these people who will then go out and do the work that we are doing in Santa Monica. And we have an approach right now where we are doing the initial training. We'll be doing a booster training, and we'll be doing continued follow-up calls with them just to see how the work is going. And I think one of the cooler experiences of it, these are people who had not done early childhood work exclusively previously with limited experience in mental health consultation. And we did a a checkout where we had everyone, I think we've done these at Clinical Scholars as well, like share one word in terms of what they're taking away from the the training thus far. And it was really cool to see that everyone was really grasping like the spirit of our model and what we're doing. And we're really excited to see how they can then implement that and impact another community and more families outside of Santa Monica.
And I just wanted to add that just before this webinar, we got off the phone with someone from the African American Alliance here in LA, and they're really interested in us bringing this model to South LA, and it would be our full transdisciplinary model. So not just the mental health component, but actually the training providers in South LA to do the full model in a very, so South LA, for those of you who don't know, is a very under-resourced community. So we'd really be working to build their community up to have the resources to do what we're doing, which is really exciting.
Yeah, so as you can see, like the work we're doing is starting to get noticed and we're starting to disseminate it, and it's been a really exciting process so far. So currently, what we have is a situation where we've collected a ton of data that has been inputted, and I have stacks of it sitting in my office as we speak. So we kind of feel like we're drowning in a lot of the data right now, and we continue to work on not only screening children to see who is at risk, but also working with the district to continue to collect this baseline wellness information on individual children that I'll get a little bit more into. At some point, we hope to shift and be able to actually do something from a research perspective with the data, but right now we're currently feeling a little inundated with the amount of data that we have collected, which is a good problem to have. So these are the evaluation tools and instruments that we've used thus far. These are different tools that have been collected for each child by the district already, and we added the Adverse Childhood Experience Questionnaire on top of it. So last year, we administered the ACE questionnaire to every child as a screener tool. We have the Ages and Stages questionnaire, as well as the social emotional component, which is a developmental screener to flag certain children who need support in various areas, including things like speech and language, fine motor skills, gross motor skills, and one area I feel like I'm blanking on, the ASQs.
Oh, yeah, fine motor, personal, social, gross
personal,
motor.
social,
Yeah,
gross
communication.
Motor. So we're following the students on those domains. The DRDP is the Desired Results Developmental Profile that assesses a lot of different areas, including things like cognition, self-regulation, social emotional development, so on and so forth. And what we're hoping to do is, because these are administered at various time points throughout the year, we're hoping to see if our program is having a positive effect on particularly the areas of social emotional development, regulation, and those areas. Something that we are actively working on as well in terms of the evaluation is trying to find a good control group to see if there is a difference between schools, classrooms, kids who receive our services versus those who do not. Within our district, we weren't able to have a clean control group because we wanted to make sure, for clinical reasons, that everyone received our intervention. So we're actively trying to find a good group to compare our model to, or compare the work to see if what we're doing is impacting the children. In addition to the quantitative data that we are collecting as a group, so me, Laura, Maya, as well as other people from our agency and from Santa Monica Malibu School District and Child Development Services, we meet quarterly to discuss and assess the different things of the program, what's worked, what hasn't worked, what can we do better, what can we do differently, what are the needs of the families, what are the needs of the teachers, are we meeting those needs? And we're really using that information to have this iterative process where we're getting feedback and then incorporating that feedback to better the program. So our main goal there is to really see if the changes, to discuss the changes and make sure they're reflected in the work that we're doing. And we'll continue to analyze the data to see if our program is effective in doing what our objectives said that we were hoping to do. More outcome and evaluation plans. So part of this LAUSD training, we've actually partnered with UCLA, and UCLA worked with us on assessing the efficacy of our initial training that we did. So it really was a transmission of knowledge. So it was like a pre-post test done at the beginning of the day and the end of the day to see if the people we were training were actually learning the material that we thought we were teaching. So both days of the training, there was this pre and post assessment. And what we're hoping to do at some point, either on our own or in conjunction with UCLA, is to see if we can move from the transmission of knowledge to model replication. So not only are people learning how to do this, but are they actually doing it in the way that we envision the model would work? So like a fidelity check of some sort. In addition to that, right now we are only collecting individual child data, but because we're a consultation program working primarily with the teachers and holding the teachers to better support the children, we really want to see how we are doing with impacting teachers and classroom variables like the environment, as well as the nutrition aspect, the occupational therapy aspect, and ultimately the whole package, since we are a transdisciplinary approach.
So in terms of our next steps, we're really looking at dissemination and sustainability. The branding process was actually pretty remarkable. I will speak for myself, but I think the whole team was kind of blown away by the whole process of getting into like what is our core, they called it the brand DNA, and what we're about, how we evolved, and kind of our voice and message. And that really helped distinguish us. The whole process helped distinguish us versus some things like Head Start, and really identify, get a clear idea of who we are as a program and what we provide. Yeah. And then these trainings that Matt was talking about really gave us an opportunity to think about what is it that we're doing and how would we describe that to other people. So I think for a long time, we've been doing the work and it's been sort of like second nature to us. Also, we have a really talented group of clinicians and partners that we're working with. And so people are coming in with a lot of expertise. And so when we talk about like, oh, do consultation, we barely have to train them. They already know what to do. And so then when we think about transferring this knowledge of what we're doing to another group that may be equally expert but doesn't have exposure to what we've been doing, we had to really distill what is our model, what is our framework. And so we developed like fidelity measures to make sure that when someone says they're doing our model, they can actually go through and a checklist and check off and see like, oh, these are the core elements of the model. I know that I'm doing it. And then that led into the training curriculum. We used those fidelity measures to base our training curriculum of like, well, how do we train the people to do these core elements? We did the LAUSG training, working on the LADMH training. And then I think Matt had mentioned a lot of these things already. And I think in terms of our dissemination plan for the future, we really are looking at other ways that we can, other regions that we can partner with, other agencies, other school districts that we can partner with to spread this out further. We've been networking with other model developers. We've spoken and connected with developers of parent-child interaction therapy, child-parent psychotherapy, the pyramid model. These are all early childhood, and circle of security. These are all early childhood models where people have, the actual developers, we've been able to talk with them, and it's been really rich conversations and helped us to understand what we need to think about in terms of intellectual property, for instance, and how do we bring our project to scale in a way that's really wise and intentional and from the very beginning, rather than letting it sort of get away from us and then realizing things that we should have done from the start. Yeah, and then for our sustainability plan, we're trying to follow the money. We're really trying to build a patchwork approach. So as we're looking for different funding, we're realizing it's going to be extremely rare for us to get this funded in one fell swoop. And so what we're going to need to do is think about how can we fund the mental health component? How can we fund the OT component, the nutrition, the physical health? how can we fund those different elements? And part of it's going to be coming from county funding, like the LA Department of Mental Health, or our foundation through grants and donors. But we also have available to us some federal, county, and state funds. So like, for instance, in California, there's been some new Medi-Cal dollars put aside for mental health consultation in preschool classrooms, or I think in classrooms in general, but for us, preschool classrooms. And so we're thinking about how could we use some of that funding to fund our project. And then we're also looking at our dissemination plan as something that can be a part of our sustainability plan. So when we train other agencies, we're charging for it, and we're trying to charge an amount that would be something that we could take that money and put it aside into our foundation that would fund our work in the city of Santa Monica to continue going. So, so yeah, that's how we're trying to sustain this work. It's still very actively in process, but we feel like some things are starting to come together, and we're really actively working on it. So I don't know if anyone else has anything to add, but it looks like that's kind of the end of our presentation right now. Here's a list of our references in case you want to read up on early childhood consultation and ecological models. There you go.